Get started. Okay. Okay. Good evening, everybody. Good to see you all. We really appreciate you here. I just want to remind everybody we are officially open for registration for classes. So please look at the what's happening or go online to get information. It is our pleasure to introduce Armin Rahimi, who will be speaking to us about vaccines. Armin is a graduate of the Lloyd L. Gregory School of Pharmacy in West Palm Beach, where he received a doctorate in pharmacy. This school is affiliated with Palm Beach Atlantic University. While working as a pharmacy manager, he is working toward his MBA at Purdue Online. We thank Armin for spending time with us this evening. Okay, Armin.
Hi, good evening, everybody. I'm going to be talking to you a little bit about vaccines and immunizations, kind of the more common and recommended one. Vaccines, as we, get older, we're going to need a little bit more help with our immune systems to try and fight off certain infections. So I'm going to start off just talking about the different types of vaccine types. So with every vaccine that's made, it could be either a live vaccine or it could be a dead or inactivated vaccine. Most of the time with a lot of the vaccines that we have these days, they have got kind of headed toward being a dead vaccine because the live ones have tend to cause more reaction in patients. So really the difference is with live ones, you get a live vaccine, the actual virus has time to replicate in the body to mimic a natural infection, which would then stimulate an immune response, causing your body to start developing the antibodies as if it's a real infection. Well, with this type of live vaccine, it was causing way too many types of reactions where people had gotten, sick and, for example, the Shingles vaccine, it was a live vaccine for the longest time. And, as of a couple of years ago, it finally became a dead or inactivated vaccine. Now, the inactivated vaccines work where they take the virus and they splice or they cut down into DNA fragments where they're not able to replicate, and that's why they're known as a dead vaccine. And from then on, there's antigens that are part of those fragments that stimulates the immune response, just like it would as if it was a live one, except you're not getting the full amount of infection per se as the real thing. So what an antigen is, it's a toxin or foreign substance that induces an immune response, especially in the production of antibodies, which is what we want, in the event that we come into contact with anybody or anything that has, said virus. So I'm going to go to the next slide. And just to kind of piggyback on, the different types of vaccines, to get an idea if it's a dead vaccine or inactivated vaccine, typically it's going to be an intramuscular injection in the deltoid muscle of the arm. If it's a live one, it's going to be a subcutaneous injection in the upper trap muscle in the arm. Most of the time, like I said, we are going to be getting probably for the most part a dead vaccine or not a live one. Next slide. This is the biggest question I get every single day when I'm giving pneumonia shots, shingle shots, flu shots. A lot of people are concerned, is it safe to get one or more vaccine, 2 vaccines at one time? And my biggest thing is, why would we want to have you come get a vaccine and then tell you to come back later? Or, what's the rationale behind of coming back later if, like I described, we're going to create that immune response to develop antibodies. So it would be smarter to do them all at one time than compromise your immune system multiple times, depending on how many vaccines you're going to be getting. So right now we're in a pandemic. I've been recommending several patients to try to get everything at one time than having to compromise the immune system multiple times, because at that point your defenses are lowered. That other thing that's out there that, we don't know a whole lot about, has more of an advantage on our immune system. So right now, it says there's data showing that it's okay to receive multiple vaccines. There are limited to no adverse events. And just like with any vaccine, there are adverse events. There are side effects that can happen. And, there's times where nothing happens, fortunately for others. So, I try to kind of put in the perspective is how many types of germs or how many things do you come into contact every single day? Your immune system is designed to handle an overload of vaccine. Say you're getting that shingles and that pneumonia and flu shot combination. And just to kind of recap on what I was describing earlier, delaying vaccine increases your risk of infections and outbreaks. It also increases the number of appointments that you'd have to make to your physician's office. And I don't know, I'm sure a lot of you have experienced probably during this pandemic how difficult it was to see your doctor, at least during the months of March and April. I'm sure it was very difficult. I'll tell you, here in the pharmacy, I had very, probably a little bit limited on my prescriptions that were coming through because people weren't going to the doctor. So, that's why the pharmacy is a good point of reference to get a vaccine, whether, you know what you need to get or you qualify for. And we'll get a little bit more into that when I go through each different vaccine that is available and, who it would apply to. And then the last thing too is that, delaying a vaccine would increase the likelihood that the vaccine schedule might not get completed, which would be in the case of, hepatitis or shingles or pneumonia. And like I said, we're going to get to that next. So on the next slide, I'm going to cover the different vaccines that are available at the pharmacy. Some doctors' offices carry vaccines, but, their inventory is a lot more limited. They're seeing patients the majority of the time. And, it's better for the pharmacy because we're carrying, heavy amounts of inventory, a couple $100,000 worth of inventory. It would make more sense for us to carry all of these vaccines as we're seeing so many patients every single day. So we have, our common influenza flu shot vaccine, pneumonia, shingles, hepatitis A and B, the Tdap vaccine, meningitis, MMR, and HPV. And you can go to any pharmacy, whether it be Walmart, CVS, Walgreens, the pharmacy of your choice. Those vaccines are all available at the pharmacist's disposal. I know here at Walmart, you don't have to make an appointment. You can just walk in. So in the next slide, we're going to start talking about influenza or the flu. So the different types of flu are A and B are what causes the human disease, the one that's out there that we're constantly exposed to. And that the type A would include H1N1 and the H3N1, which are responsible for, the pandemics we've had in the past, as you know, about the swine flu with the H1N1 and so forth. The type B is a little bit more rare. Those, we're exposed to it, but it has come up in the past. It changes every single year. The flu shot is reformulated with the different strains. Yes, just because the flu wants to avoid us making the antibodies and the resistance developing against it. So that's why, viruses are constantly replicating. They're constantly mutating to, be stronger, even against. That's why we need to vaccinate every single year with the flu. And that's the other thing too, with the whole COVID pandemic is that they're saying that there's strains and resistant strains. I'm sure you've heard out there, one person got, COVID and, didn't have an issue, but then they got reinfected with a different type of strain. And it works the same way with any type of viral infection that's out there. It's just the nature of it, is specific. So in the next slide, influenza or flu-like symptoms can onset about 2 days, within 1 to 4 after exposure. And you can be contagious the day before you become symptomatic. So when you start having, the sniffles or head cold or runny nose, you could be completely asymptomatic and still, be contagious and spread that, flu amongst others. And then 5 to 7 days after the onset of symptoms, you're still, contagious. And like I said, the symptoms include high fever, cough, fatigue, weakness, headache, and muscle aches. Some complications associated with the flu can be pneumonia. Community-acquired pneumonia is probably one of the most common forms, as we've gathered, obviously not right now, but gathering together in groups. That's kind of how it comes. And a pneumonia can eventually exacerbate the pulmonary and cardiac-related conditions for, more so the elderly. And that's why with the flu shot that's available there is one for seniors that's 65 and older. And we'll get to that in just a moment. Also, hospitalizations can occur as a result of the flu. And, that's at the cost of not getting a flu shot typically. So the next slide, talk about the vaccines. The flu shot, I just want to specify to everybody, to the misconception, the flu shot does not cause the flu. I get my flu shot every single year. I've been getting it probably for the last 13, 14 years. And I always like to tell the story that, I was a high school soccer athlete, trying to take on a lot of coursework at the same time. And I would always get bogged down, tired. And I would get the flu around October, ironically, when that's the peak season. So I started getting my flu shot, early, probably when I was 18. And I just consistently stayed, every single year getting my flu shot. And it had gotten to the point where, either I built a resistance against it, or even if I had gotten the flu, it was only maybe a couple hours that it would last. So as you can see, we have different types of flu shots. We have the trivalent, the quadrivalent. Right now, these are the current strains that are available in the quadrivalent for this year's flu shot. There's also a high dose for seniors, like I've mentioned. And vaccination should really occur around early September into October. So, if you haven't gotten your flu shot yet, I would highly recommend that, you try and you catch up on that. And, I would say, whatever pharmacy you go to, try to make an appointment tomorrow morning if you're able to. I'll be here tomorrow morning if you really want to get your flu shot. I don't mind. You just try to get it. We want to try and avoid any type of further complications that can occur with the flu shot. And I'm just going to grab my phone charger real quick because my phone is on low battery and I don't want to lose you guys. So just bear with me one moment.
So if you're wondering where Walmart is that Armin works in, it's on Coral Springs Drive and Atlantic Boulevard.
All right, I'm back here. Let me just get this plugged in. Okay, so with the flu shot and with just general vaccination.
You were unable to take your call.
Sorry about that. With general vaccines, you can have adverse reactions such as pain, warmth, or redness near the injection site. Very common. I had a lady call me today. She had gotten 3 vaccines, and she had some redness and a little bit of pain at that area that she had received the vaccines. And I told her not to worry. There's precautions you can take. Such as Benadryl, icing that area. Just trying to get the swelling to go down. It might take a day, 2-3 days or so, but eventually it will go down, and your body's immune system, is just working at trying to, develop those antibodies against, the flu, for example, or pneumonia. I think I gave her a tetanus shot as well. So other than that, the injection site reactions, we have drowsiness, fatigue, headache, diarrhea, nausea, vomiting, cough, wheezing, runny nose. Now, these are reactions that have been studied and been known to, occur. Does it happen with everybody? No. I mean, does it happen to somebody? Some of us, yes. I might have had a runny nose. I'll be honest. Probably I got my flu shot. I had a runny nose for about a few hours on Saturday, the day after I had gotten it. I think I got it Friday. It happens, and that's just your body trying to work against it and be ready to head into the season, as they say. So I'm going to go to the next slide. We're going to talk about pneumococcal disease. So pneumococcal disease, is caused by a gram-positive bacteria called Streptococcus pneumoniae. It's the leading cause of vaccine-preventable illness and death in the United States. Frequent cause of secondary bacterial pneumonia following the flu. This threat can exist all year round. There's not an actual season like the flu where it peaks. It's around everywhere. Like I mentioned, community-acquired pneumonia. It can happen in crowds. Immune systems defenses are down, germs are spreading. It's there. Typically, antibiotics do work against pneumonia, but as these bacteria, develop resistance, the antibiotics don't work as well like they used to be. And then that's why, it's the doctor's job to be vigilant of that and maintain an antimicrobial stewardship over the antibiotics that they prescribe, and that's been the biggest challenge with pneumonia and pneumonia disease and whatnot. So that's why we have vaccines for the pneumonia. On the next slide here, I'm just going to talk about, what exactly pneumonia does. It can cause bacteremia, where there's bacteria in the bloodstream. It can cause meningitis in the meninges of the brain, and it can cause arthritis. It can also affect the lower respiratory tract, where in the lungs, that's where the pneumonia gets in. And then in the upper respiratory tract, it can cause sinusitis or inflammation of the sinuses, and it can cause ear infections or otitis media in the ear canals. So, these are things that, we need to know, why we're getting a pneumonia vaccine, what are we trying to prevent against? So, let me go back. So with that said, there are 2 doses of pneumonia vaccine. So for seniors 65 and older, the first dose would be Prevnar 13, and that would be given initially. I tend to try to give that one with the flu shot if I can, but obviously when we're in the off season, I try to, make sure that people are still up to date with their vaccines. I check their records with the state registry and just making sure. So we give that one first, and it's given intramuscularly in the deltoid muscle. In the event there are special populations that can qualify to receive Prevnar in certain studies that aren't 65 and older, and that would include patients who have HIV, chronic renal failure, nephrotic syndrome, or the cochlear implants. And if you know what cochlear implants are, those are the small electronic devices that stimulate the cochlear nerve, to allow people to hear. Young children, sometimes unfortunately have gotten those, and as they get older, they are qualified for this vaccine. The second dose that follows Prevnar a year later is Pneumovax 23. So that one, I try to, just remind patients when I'm giving them the first dose with their flu shot, hey, make sure next year we follow up with the second dose of pneumonia with your flu shot, just to, follow or piggyback off of it. A lot of times I try to do my best to remind everybody, but, it's also your responsibility to your health. It's your body. You want to try and, protect it as best as possible and make a note. I do provide vaccine little checklists or schedules to, write the date and remind you when you're next going to need that second dose for the series. With pneumonia shot for 65 and older, that Prevnar 13 vaccine that I mentioned first is only given one time. The Pneumovax 23 that you receive a year later, that can be given every 5 years following that dose. So that's another thing too that people tend to forget. And I've been at my pharmacy for about 5 years right now, and I've actually made some phone calls, for people that I vaccinated 5 years ago for that pneumonia shot. Hey, it's been 5 years, come make sure you get your shot, and might as well knock out your flu at the same time. It's very important. Now, if you're not 65 and older and you are in the population of being a diabetic, you have asthma, you have a history of COPD, you have heart disease such as stroke, history of stroke or heart attack, you're a smoker, or you have chronic alcohol use, you do qualify to use the Pneumovax 23 vaccine. This is typically most commonly given. The Prevnar 13 is very rare that you would give those to the other populations I mentioned before, unless you're 65 or older. And this is an important thing because patients that have those conditions already have a lower immune system. It's harder for them to fight off these infections that are out there. So vaccinating against pneumonia is a very proactive approach for people under the age of 65 that have those conditions. Next, and just to also follow up, this is also given intramuscularly as well. It's not a live vaccine. Okay, now we're going to talk about shingles. Shingles is a it's a dormant version of chickenpox. I'm sure many of you have had chickenpox as a child, and that virus lives latent in the dorsal root ganglion, which is in the nervous system, and can reactivate and travel along, the neuronal cell axons, and eventually it comes out later in age. They've studied that most of the time it's after age 50 and up, but I have seen rare cases where, a 34-year-old or 45-year-old will get shingles, and who knows how that could have happened. Stress is a big activator of the shingles, and it's something that can be very painful and very uncomfortable if we don't catch it early on, or we're not proactive in vaccinating against it. So shingles can appear localized as a rash on the skin. It can cause certain conditions or complications such as post-herpetic neuralgia, where it's kind of like a neuropathy where you start feeling like nerve pain in the tips of your fingers or the balls of your feet, and it can be very frustrating and bothersome. There can be scarring from the rash that, the rash can start scabbing too at some point in certain cases, and that can lead to scarring. Bacterial infections, any type of open skin or cuts or wounds, is just, a bed ground for, bacteria infection to occur. And the other thing that can happen would be ocular abnormalities. This can affect the ocular nerve. I've had patients come in here and say that it affected their whole eye. They couldn't see for a month, because the shingles was so bad. The good thing is we do have medications and antivirals that are there to suppress the shingles, but we don't even want to end up in that situation. We want to try to vaccinate against this. So in the next slide, the vaccine that's approved for the shingles is called Shingrix. It's a 2-dose series given between 2 and 6 months. So your initial shot you're going to get your initial shot, in the beginning month, and then between 2 and 6 months later, you're going to get that second dose to complete the series. 97% effective against the shingles in adults 50 to 69, and 91% effective in adults over the age of 70. So as you can see, it's had very good success rate. It's not a live vaccine. Its predecessor was Zoster. I don't know if anyone is familiar with that one. It came out in 2006. That vaccine was a live vaccine and had a lot of adverse events and just low effectiveness rates. This new Shingrix one has shown to be much more effective, and even in 88% of patients, the pain that they have in the injection site. This is the caveat with this one, is that pain is more common with this vaccine than any other vaccine. And it can, feel like someone had punched you in the arm for a few days and it just hasn't gone away, but, it's not anything in comparison to what the shingles feels like or how it can affect your body. I will say that this vaccine is contraindicated in patients with a previous shingles outbreak less than 6 months. So if you've had shingles in the last 6 months, this vaccine is not to be given. If you're thinking about getting the vaccine, please make sure that you communicate this to your doctor or pharmacist or nurse. That way, it's not given, because it could then even activate it even more if it's given in combination. It's given intramuscularly, and it's indicated for patients 50 and older. Okay, and the next slide. These are just the adverse reactions we talked about: redness, swelling, muscle pain, fatigue. This one has more fever associated with it than other vaccines. It's just, it's an effective vaccine, but it does have a little bit more adverse reactions. Next slide. Okay, we're going to talk about tetanus, pertussis, and diphtheria. So how many of you been, working around your house or in the garage or somewhere in the yard, and you've cut yourself on a piece of metal, or you've stepped on a rusty nail? Tetanus, this is how you can get the, tetanus, and a lot of complications can lead to it. So typically, tetanus are spores found in soil, dust, or feces. It's a toxin that binds to the nervous system and prevents muscle relaxation. So, you can have symptoms such as lockjaw, spasms, muscle rigidity. In worst case scenarios, you can have a mass exudate of mucus, where you have an overproduction of just saliva and mucus that are being, pushed out from the blood vessels. You can have a cough, runny nose, or even potential low-grade fever when you get tetanus. It can be transmitted through the respiratory tract or contact with, the actual lesion, in the skin. Next slide. This is to follow up on transmission of tetanus: puncture wounds, lacerations, abrasions, injection drug use, piercings, tattoos, cuts, and there's my rusty nail example. Next slide. So we have a vaccine for this one, and this one is given every 10 years. It's pretty effective. You ever cut yourself or anything, you can go to the pharmacy instead of having to go to the hospital to get this vaccine now. I remember before when, you couldn't get it, it was a mission to get to the hospital, how long the wait was going to be. And, this is a faster alternative way, to come to the pharmacy to get it. Boostrix is one of the Tdap vaccines. It's recommended in ages 10 and up, and Adacel is recommended in ages 11 to 64. Me, typically as a pharmacist, I try to stick to Boostrix just because I don't have to worry about that age restriction. If I, let's say I was to miss somebody that was 68 years old, well, they wouldn't qualify for the Adacel. The Boostrix would be more preferred. So I just stick to Boostrix. It does the same thing. And then once those vaccines are given, 10 years later, you just want to get a TD booster. You don't need a Tdap. You need a TD booster 10 years after that. Also, Tdap vaccines are given at every pregnancy. So, you could have, up to 3-4 children, the mother is going to have, that many Tdap vaccines to cover each child. And that's given typically between weeks 27 to 36 of gestation. All right, and the next slide. I'm just going to briefly touch on meningococcal vaccines. These are vaccines that are pretty common for, kids going to away to college or people who are traveling. And there's the different types, A, C, Y, and W that they cover. The two different vaccines that are commonly given are Menimune and Menactra. The Menimune is a 0.5 ml dose given between ages 9 months to 55 years. And the Menactra is a single dose given between ages 2 to 55. So, those are vaccines that we get, as children, but there are some, adults that just haven't gotten that vaccine, or the titers in their bloodstream aren't recognizing it, and you need paperwork, for example, to travel into certain countries. I've had different types of Muslim people traveling to Mecca for the pilgrimage, and they needed to get a meningitis vaccine to have proof before going into Saudi Arabia, for example. So, other than that, meningitis is common in college dorms, so college students do receive it as well. It's important to have because meningitis is a very, it comes in two different forms. It's bacterial and it can come in viral, and it's swelling of the meninges, and the chance of recovering from it are very, low. So we want to prevent and vaccinate against meningitis as early as possible, in our younger age. All right, the next slide, we're going to talk about hepatitis A vaccinations. This is another travel vaccine given typically, if you're traveling somewhere or if you haven't had it. Most of us haven't had it. I hadn't had it because it's not really required, but it's typically you can get hepatitis in a lot of underdeveloped countries, especially with eating food over there. It's transmitted through the fecal oral route, to be honest, and this could be different types of animals, or how the food's been cooked in certain different restaurants, or especially when you're traveling. So you want to prevent against this too if you're ever thinking about going to the other side of the world, away from the Western Hemisphere. The two different kinds are Havrix and Bacta. You get one dose initially, and then you get a second dose 6 months later. And that's what I have on hepatitis A. Next slide. I have hepatitis B. Hepatitis B is a chronic condition of the liver that presents with symptoms of jaundice, dark urine, yellow skin, and eyes. This is typically received when we're very, very young, as kids. But there are some people that have come here from the to the United States that have never had this vaccine. And to be quite honest, I give it pretty frequently. Not as common as the other ones, but I do have people coming in asking for this. So it's a 3-dose series given initially at 0 months, then a second dose a month later, and then the third dose 6 months later from the first dose. So that's a little tricky because, if you miss that drug schedule and you're outside of the range, you have to redo the whole series all over again. So it's very important that we, make sure we write down our dates in our calendar, or set a reminder, and not make sure we take care of that one. It can be given to all infants, adolescents who have not been previously vaccinated, high-risk adults, multiple sex partners, injection drug users, patients on dialysis, chronic liver disease, diabetics, and travelers, as I've mentioned, traveling vaccine as well. All right, next slide. I have measles, mumps, and rubella. It's transmitted through the respiratory tract. It's highly contagious. Complications or symptoms of MMR include cough, runny nose, rash, diarrhea, pneumonia, and ear infections. It's very common to see sores in the mouth, and ironically, or oddly enough rather, it can cause arthritis in females. So, it's one of those things that, we need to vaccinate against as well. I believe measles was eradicated in the United States, but, you know, lately we've had a lot of people not wanting to vaccinate their children, and, you know, we're having a result of, you know, certain outbreaks in different areas of the country. This is one of the vaccines that has been, you know, shown some controversy in probably recent years because of its link to autism. You know, to date, it does not cause autism, and it has been proven that it's not linked to it. You know, although there are lawyers out there that would beg to differ. However, this is a vaccine that you give 2 doses to children between 12 and 15 months, and then again at 4 and 6 years of age. If an adult was born before the age of 1957, they're typically considered immune to MMR. But if the adult was born after 1957, they would require 1 or more doses of MMR. So I have some of these patients that have had to come in that they've never had this vaccine. I've had people travel from South America and Haiti receive these vaccines. So, you know, it's common. This is a vaccine that is given subcutaneously. It's a live vaccine. It's one of our few live ones that we still give. All right, next slide. We're going to talk about just briefly HPV. This is a virus that has more than 100 types. However, we've identified the high-risk types that cause cancer, and I have listed here on the slides. It's 16, 18, 31, 33, 39, 45, 51, 52, and 58. And then there's low-risk types, which is 6, 11, 40, 42, 43, 44, 54. And this can cause, you know, low-grade pap smear abnormalities or warts. It's the most commonly sexually transmitted STD. And, you know, this is one of the newer vaccines that have come out, you know, that we didn't have growing up. And that vaccine is called Gardasil. It's approved for males and females ages 9 to 26 years old. And it is a 3-dose series as well that you get at 0 months, 1 month, and 6 months, very similar to the Hepatitis B schedule. It's an intramuscular vaccine. It's not live. And, you know, I would recommend it to, you know, ask questions at the pediatrician's office. If you have grandchildren, check with mom to see if they've gotten vaccinated against this, because, you know, the population, as kids are, the millennials and, so forth, they need to be protected against this. They need to be educated against this as well. Next slide. I have here vaccine adverse event reporting system. So if you ever get a vaccine and you experience an adverse reaction and you feel that, it's something you want to alert your pharmacist or doctor, or, even if you wanted to report it yourself, you can go to the VAERS website, that I have listed here, vaers.hhs.gov, or I believe you can even go to the CDC and click a link to get linked to it. But this is just for reporting any type of anaphylaxis or chronic arthritis or encephalitis or any type of thrombocytopenia. Doctors utilize it, pharmacists utilize it, nurses and general public. So that's available there for your, and I don't, know how many people know about it, but it is something that is available. All right, next topic of discussion, I'm going to just briefly cover what we know and what's out there for COVID-19. So as you know, COVID-19 is a novel coronavirus, SARS-CoV-2. It's an enveloped positive sense strain, single-stranded RNA virus. It causes acute respiratory syndrome, and it's a zoonotic virus. As we know, we've seen that it's come from a bat, potentially. This pandemic that we are in started in March 11th, and 14 million have been infected with COVID up to date as of July 2020. Right now, there were 137 vaccine candidates trying to do research to lead a vaccine study. Right now, Moderna is currently leading this study as they've gotten to phase 3. Now, phase phase 3 has not been initiated, but they are still recruiting about 30,000 participants for this vaccine trial. And as a matter of fact, the closest one to us is in Hollywood, Florida, at the Research Centers of America. There's 100 centers across the world right now that have opened up participants. I think I had somebody here at the pharmacy, if I'm not mistaken, tell me that they signed up for it. So, I'll be interested to hear, what the inclusion and exclusion criteria are. I'll cover that in the next slide. Right now, this trial that they're undergoing for this vaccine is a 2-dose intramuscular vaccine. So we're probably going to assume that it's not live, and it's 100 micrograms of mRNA. It's a scientific name right now that they've dubbed it. It has not gotten its official name yet, obviously, because we haven't completed the phase 3 trial. And just so you know, for any drug or vaccine to get approved, it has to go through phase 1, 2, 3, and safety trials for it to get FDA approved. So for us to have gotten this vaccine at phase 3 means we're close, but they still have to do a trial for safety on it as well. So this vaccine is going to be given on day 1 and then again at day 29. It's a 2-dose vaccine. Next slide. Can everyone still hear me?
Yes.
Okay, just making sure. So next slide. This vaccine trial has a few primary outcome measures. The number of participants with a first occurrence of COVID starting 14 days after the second dose of the vaccine. The second outcome is the number of participants with adverse events or medically attended adverse events leading to withdrawal. So they're measuring pretty much people who had an adverse event and had to, be taken to the hospital, which led to the withdrawal from the study or the trial. The next measure they're looking at is the number of participants with solicited local and systemic adverse reactions, and also the number of participants with unsolicited adverse events or reactions. The inclusion criteria for this trial includes people ages 18 and up, high-risk COVID-19 infection, non-child-bearing females, males practicing contraception, healthy adults with pre-existing conditions, which would, technically be, diabetes or, asthma or, something that, is somewhat immunocompromising. The exclusion criteria includes anybody who is acutely ill or febrile, pregnant or breastfeeding females, previous administration of other investigational vaccines, or anybody that is on immunosuppressants or undergoing immunosuppression, such as, chemotherapy or et cetera. The next slide. Right now, you've heard a lot of talk about the different types of tests. There's 3 different tests that are out there. There's the molecular test, the antigen test, and the antibody test. The molecular and the antigen test is that nasal swab that you've probably seen, where you have to take a swab and it goes down pretty much into your nasal cavity, and it can be quite painful and sometimes cause bleeding. These results for the molecular ones take about a week. The antigen ones take about an hour. So, in the beginning, we had no idea how long these results took, but, we've had a lot more time has gone by that we have an idea of how fast these tests work. The antibody tests involve a finger stick or blood draw, and that could be 1 to 3 day results. The molecular and antigen tests diagnose active coronavirus, whereas the antibody test determines whether you've been infected in the past. As of right now, we don't know where this vaccine study is going. Obviously we want it to be safe. We don't want it to increase mortality. which I don't know if you've heard, but Johnson & Johnson had an issue where they had to stall their vaccine trial. So as of right now, Moderna looks like they're on the right track, but we just don't know when or how much longer it's going to take, despite what you hear in the news or the media. There's still, you go to the clinicaltrials.gov and it still shows that they're still actively recruiting for this phase 3 trial. So, that concludes my presentation. I hope it was, somewhat educational, and a lot more about vaccines now. And, if you ever have any questions, you can always call me here at the pharmacy. I work here on Atlantic and Coral Springs Drive, but honestly, you can call any pharmacist, any pharmacy that you go to, you can call that pharmacist if you have a good relationship with them. And, they'll talk to you about vaccines and, and you can clear up anything that's not, making sense. Thank you, everybody, for your attention. I appreciate it.
Thank you so much, Armin. Does anyone have any questions? I guess not. Thank you so very much. Please, everyone.
You're very welcome.
We really, really appreciate your coming out. Please, everyone, look at the weekly What's Happening for all our upcoming adult education and lecture series. All the information about sign up, like Judy had said earlier, is in there.
Thank you, Armin. I hope everybody learned something. I certainly did. There certainly are a lot of vaccinations out there, but I know Andy and I have come to you for vaccinations quite often, so we appreciate learning all this important information. So if you haven't gotten your flu shots, please get your flu shots, etc. Thanks again.
Thank you.
You're welcome.
Good evening,